Scientists studying the new UK variant of COVID are certain about one thing: it's more infectious than previous strains of the virus. But there was no evidence that it might be more lethal. This evening, we learn there is. The chief scientist spelling out the results of a new analysis on deaths linked to the virus.
If you took somebody in their 60s, a man in their 60s, the average risk is that for 1,000 people who got infected, roughly 10 would be expected to unfortunately die. With the new variant, for 1,000 people infected, roughly 13 or 14 people might be expected to die.
But the conclusions are currently built on shaky scientific ground. Estimates of who's been infected with the new variant come from community testing data, not hospitals. Yet the majority of people who die from COVID are tested in care homes or on wards. So while the new analysis found a 35% increase in your risk from dying from the new variant compared to previous ones, it was only able to look at 8% of deaths from COVID, a small sample. What's more, a separate analysis of mortality data from hospitals found no increased risk of dying from new variant COVID at all. According to one of the scientists who led the research, it's very much a work in progress. How confident are we right now in that conclusion?
I don't think we're very confident at all. What we see is that this pattern with the database that we've looked at, which is a very large database, but still is quite a small fraction of the total deaths. So I think we really do need to look at that more carefully using other data sets.
Given there are other new variants originating in South Africa, South America and probably elsewhere, the finding increases pressure on government to further tighten border controls, especially given scenes like this at Heathrow today.
We may need to go further to protect our borders because we don't want to put that at risk by having a new variant come back in.
But the fact remains there are currently more than 1 million new infections a week inside our borders. Tinkering at the edges will do little to bring our own epidemic under control.